Did you know that up to 37% of routine medical tests performed on seniors over 70 actually lead to unnecessary treatments, complications, or even lifelong side effects? And shockingly, 99% of seniors have no idea they are being overtested. Even more alarming, one of these common health checkups is linked to 5% of all cancer cases in the United States. That's the same cancer risk as drinking alcohol every day. But here's the catch: most doctors don't warn their patients about these risks, and you won't see this on any health billboard. Today, we're going to uncover the hidden truth about the 5 health checkups seniors should avoid after age 70, tests that may actually do more harm than good. It's time to take control of your health with facts, not fear. Before we dive in, we want to hear from you. Where are you watching from? How old are you? Have you ever regretted a medical test or procedure? Do you think seniors are tested too much? Share your experiences and questions in the comments below. We read and reply to every message with personalized advice. In this video, we'll break down each of these 5 tests, what they are, why they are commonly recommended, and why they may be dangerous or unnecessary past 70. We'll also share real-life stories and safer alternatives backed by science, so you can make smarter decisions about your health. If you care about protecting your well-being and avoiding avoidable harm, hit the like button and subscribe to our channel for more trusted senior health tips. Alright, let's get started with number 5 on our list. It might seem harmless, but it could quietly be hurting your quality of life. Checkup 1. Bone Density Scan DEXA. Let's start with number 5, the Bone Density Scan, also called a DEXA scan. This test is widely recommended to check for osteoporosis, a condition where bones become fragile and more likely to break. The scan itself is painless and quick. You lie on a table while a machine measures how dense your bones are, usually focusing on your hips and spine. It sounds like a smart, harmless way to prevent fractures, right? But here's the important part: after the age of 70, bone density naturally decreases. This is a normal part of aging, just like getting wrinkles or gray hair. So, many seniors' scans come back showing low bone density even when there's no real risk of breaking bones. This is where the problem starts. Doctors often respond by prescribing medications called bisphosphonates, which are supposed to strengthen your bones. But these drugs can have serious side effects, like jawbone death, a rare but painful condition where the jawbone starts to deteriorate, and irritation or inflammation of the esophagus. Studies show that in people over 70, treating mild bone loss with these medications only reduces fractures by about 0.3% over 5 years. That's a very small benefit. Now, let me tell you about Rose. She's 76 years old, a retired piano teacher who was perfectly healthy, no history of falls or fractures, and she walked every day. After her routine checkup, Rose had a DEXA scan. It showed she had osteopenia, which is a mild decrease in bone density, not full-blown osteoporosis. But her doctor immediately started her on bisphosphonates. 3 months later, Rose developed severe acid reflux and jaw pain. She stopped playing piano, which had been her passion for decades. When we saw her, we stopped the medication and switched her to a safer, natural approach: vitamin D supplements, a calcium-rich diet including foods like sardines and leafy greens, and weight-bearing exercises like walking and resistance bands. 1 year later, Rose was back to performing, with stronger legs, better balance, and 0 fractures. This story shows us something crucial: a number on a scan doesn't always tell the whole story. For seniors who aren't falling or breaking bones, lifestyle changes are a safer and often more effective way to maintain bone health. Research backs this up. A 2022 study in Osteoporosis International found that strength training, balance exercises, proper nutrition, and correcting vitamin D deficiency reduced fracture risk by over 20%, far more than medication in mild cases. So, if you're over 70, Don't let a scan scare you into starting medications with serious side effects unless you've had fractures or significant risk factors. Instead, focus on what you can control, staying active, eating well, and working with your doctor to monitor your bone health carefully without rushing into treatments. Next, we'll talk about a scan that often causes even more anxiety and unnecessary procedures, the brain MRI for memory loss. Checkup 2. Brain MRI for memory loss. Now, let's talk about checkup number 4, brain MRIs for memory loss or mild cognitive complaints. This is a test many seniors get when they start feeling a little forgetful or confused. The idea behind ordering an MRI, which is a detailed imaging scan of the brain, is to rule out serious problems like tumors, strokes, or other treatable causes of memory loss. But here's the reality. In seniors over 70, most brain MRIs simply show normal age-related changes. These include mild brain shrinkage and white matter spots, which are tiny areas that appear on scans but are usually harmless. Unfortunately, when doctors or patients see these spots, it can trigger a cascade of worry and further tests, some of which are invasive and carry their own risks, like spinal taps or brain biopsies. And these follow-ups rarely find anything that actually needs treatment. One large 2021 study in Neurology Today looked at over 3,000 MRIs from patients aged 70 to 85 who had mild memory problems. They found that 86% of these scans showed abnormalities, but only 3% were linked to treatable conditions. That means 97% of seniors faced the emotional stress of a problem when there was none. Let me share George's story. He's a 74-year-old retired engineer who noticed he was forgetting names and misplacing keys more often. Concerned, his doctor ordered a brain MRI. The scan showed white matter changes, and George immediately feared he had dementia. He stopped driving and going to church. His anxiety and isolation worsened over months. When we reassessed George, cognitive testing showed his memory was actually normal for his age. We reassured him that the MRI findings were expected and not cause for alarm. Instead of more scans, George focused on lifestyle improvements, better sleep, hydration, brain exercises like puzzles, and social activities. Within 3 months, his memory stabilized, and his confidence returned. So, what's the better first step if you or a loved one have mild memory concerns? Cognitive screening tests. These are simple paper-based or digital tests that assess memory, attention, and problem-solving skills. They're inexpensive, effective, and don't cause unnecessary panic. MRIs are most useful when there are serious neurological symptoms, like seizures, sudden personality changes, or rapid loss of function, not for mild forgetfulness. If your doctor suggests an MRI for memory loss, ask whether it's truly necessary or if a cognitive screening test might be a safer and smarter first step. Next up, a test many seniors get after feeling tired or having mild chest discomfort, but it's more risky than you might think. We'll cover the cardiac stress test in just a moment. Checkup 3, cardiac stress test. Now, let's move on to checkup number 3, the cardiac stress test. This is one of the most common tests seniors receive when they complain of mild fatigue, chest tightness, or just feeling off compared to before. So, what is a cardiac stress test? It's a procedure where your heart is monitored while you either walk on a treadmill or receive medication that simulates exercise. The goal is to see how your heart responds under stress and to detect blocked arteries or other heart problems. It sounds logical. If your heart is underperforming, we want to find out why, right? But here's the problem. For seniors over 70 without clear symptoms of heart disease, the cardiac stress test often leads to false alarms. Research shows that the false positive rate for stress tests in this age group can be as high as 40%. That means nearly half of the time, the test suggests there's a problem when there isn't one. What happens next? Many seniors are sent for follow-up tests like coronary angiograms, where a catheter is inserted into the arteries to look for blockages. If anything suspicious is found, They might get stents placed or even be recommended for bypass surgery. But the truth is, these procedures don't always improve survival or quality of life for people without real symptoms. On the contrary, they increase risks such as bleeding, kidney damage from contrast dye, and longer hospital stays. Let me tell you about Raymond, a 75-year-old retired postman. He stayed active by walking daily and only mentioned sometimes feeling tired when climbing hills. His doctor ordered a stress test just to be safe. The results were unclear, so he underwent a catheterization that found mild artery narrowing. A stent was placed, but that night Raymond had a severe reaction to the dye, causing kidney problems. He spent 6 days in the hospital and needed weeks of recovery. And here's the kicker. Raymond's fatigue never improved, because it wasn't caused by heart disease to begin with. He simply needed better hydration and more rest. So, what's the safer, smarter alternative? For seniors without classic cardiac symptoms, like chest pain during activity, shortness of breath on exertion, or a significant drop in energy, a resting EKG is often a better first step. This test looks at your heart's rhythm while you're at rest, and it's non-invasive, painless, and widely available. Another useful tool is the coronary calcium scan. This is a low-radiation imaging test that shows whether dangerous plaque is building up in your arteries. It helps doctors assess your heart disease risk without pushing you toward invasive procedures. The bottom line: cardiac stress tests should be reserved for seniors who have clear, significant symptoms suggestive of heart problems. If you're feeling tired or off, but don't have classic signs, insist on safer tests first and discuss the risks and benefits carefully with your doctor. Coming up next, a test that many people assume is harmless but has serious risks for seniors, the colonoscopy. Stay tuned. Checkup 4, colonoscopy. Now, let's talk about checkup number 2, the colonoscopy. For decades, colonoscopies have been hailed as the gold standard for colon cancer screening. And it's true, this procedure can detect and remove precancerous polyps before they turn into cancer, saving countless lives. Because of this, many people believe that colonoscopies should be done regularly, no matter your age. But here's the truth: after age 70, and especially after 75, the risks of colonoscopies start to outweigh the benefits for most people. First, the preparation for a colonoscopy is harsh. You'll need to take strong laxatives to clear your bowels, which can cause dehydration, dizziness, and even kidney problems, especially in older adults. The sedation used during the procedure also poses risks. It can affect brain function and increase the chance of confusion or falls afterward. And the procedure itself isn't without danger. There's a risk of bleeding, tearing of the colon wall, or heart rhythm problems during sedation. A major 2019 study in JAMA Internal Medicine looked at over 1.3 million Medicare patients aged 70 and older. They found that for every 1,000 colonoscopies performed on patients over 75, only 2 lives were saved, but over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. Let me tell you about Dana, a 73-year-old grandmother who owned a small bakery with her daughter. Dana had no symptoms, no bleeding, no changes in stool, and no family history of colon cancer. Her new doctor, fresh out of residency, urged her to have a screening colonoscopy just to be safe. Dana agreed. During the procedure, a small polyp was removed. But that night, she experienced severe abdominal pain and fainted. At the hospital, she was diagnosed with a bowel perforation, a tear in the colon. Dana spent 9 days recovering in the hospital, lost 10 pounds, and has not been the same since. When we reviewed her case, it was clear she didn't need another colonoscopy. She'd already had 2 clean screenings in the past. So, what should seniors do instead? The U.S. Preventive Services Task Force recommends stopping routine colon cancer screening at age 75 for most people. For those in excellent health who want to keep monitoring, safer alternatives exist, like the FIT test, which stands for Fecal Immunochemical Test. This is a simple stool test you can do at home. It doesn't require preparation, sedation, or any invasive procedure, yet it catches most cancers and significant polyps. If the FIT test is positive, then targeted colonoscopy makes sense. But starting with this non-invasive option avoids many risks. Always discuss your individual risk factors with your doctor. Screening should be personalized, not automatic. Next, we'll reveal the most dangerous and overused checkup of all, one that nearly everyone over 70 has had, and that may actually cause cancer itself. You won't want to miss this one. Checkup 5. Annual full-body CT scans. Finally, we come to the most dangerous and overused test on our list, the annual full-body CT scan. These scans are often marketed as miracle cancer finders, especially in private clinics or executive health packages. They promise peace of mind by screening your entire body for hidden tumors or diseases. But here's the hard truth. A full-body CT scan exposes your body to extremely high doses of ionizing radiation, roughly equivalent to 500 chest X-rays in a single session. That radiation exposure is not harmless, especially for seniors over 70. In fact, a 2023 modeling study published in JAMA Internal Medicine estimates that the rise in CT scans in the United States may now be responsible for up to 5% of all cancers, the same risk level as drinking alcohol every day. Even more concerning, these scans often detect harmless nodules, cysts, or calcifications, natural parts of aging that pose no threat. But once these incidental findings appear on a scan, they trigger a dangerous cascade: more imaging, needle biopsies, surgeries, and all the stress and complications that come with them. Let me share the story of Marcus, an active 80-year-old martial arts instructor who participated in an elite senior health screening that included a full-body CT scan. The scan revealed a tiny 3 mm lung nodule. Alarmed, Marcus was referred to oncology and underwent a PET scan and a needle biopsy. Thankfully, the biopsy was benign, but it caused part of his lung to collapse, resulting in hospitalization and a 2-month recovery. All of this happened for a finding that could have safely been monitored without invasive procedures. Medical experts, including the American College of Radiology, now strongly advise against using full-body CT scans for general screening in healthy, asymptomatic seniors. Instead, the safest approach is regular checkups with your primary care doctor, combined with targeted imaging only when you have clear symptoms, like unexplained weight loss, coughing up blood, or visible swelling. Your time, health, and peace of mind are too valuable to risk on fear-driven, high-radiation screenings that rarely save lives but can cause harm. So, there you have it, 5 health checkups that might seem helpful but could actually cause harm once you're past 70. Modern medicine is powerful, but it's not perfect. Sometimes, less truly is more. Before agreeing to any test, always ask your doctor, what happens next? If this test finds something, will the treatment truly improve my health or quality of life? Remember, real prevention starts with lifestyle, staying active, eating nutritious foods, getting quality sleep, and being thoughtful about which tests you choose. We want to hear from you. Have you or a loved one ever experienced complications from a medical test or treatment that turned out to be unnecessary? Please share your story in the comments below. We read every single message and respond with personalized advice. Thank you so much for watching. If you found this video helpful, please like and subscribe for more trusted senior health tips. Until next time, take care and stay healthy.